Bon après-midi tout le monde et bienvenue.
Welcome to today's update on COVID-19 in New Brunswick. Good afternoon.
Update on COVID-19 in New Brunswick. Speaking on behalf of the province today are Dr. Jennifer Russell, the province's Chief Medical Officer of Health, and the Honorable Dorothy Shepherd, Minister of Health. Les porte-paroles aujourd'hui sont le médecin.
Speaking on behalf of the province today are the province's Chief Medical Officer of Health, Dr. Jennifer Russell, as well as the Honorable Dorothy Shepherd, Minister of Health.
Merci, Bruce. Thank you, Bruce. Good afternoon, everyone. Bonjour à toutes et à tous. Je tiens à discuter aujourd'hui.
Today, I want to report on some of the hopeful signs we are seeing in our efforts to slow the spread of COVID-19 in New Brunswick. But I also want to point out the continuing challenges that we face and how we can all work together to bring the entire province back to the yellow alert level. I'd like to begin by thanking all New Brunswickers who are adhering to public health recommendations and guidance. In particular, I want to express my gratitude to the residents of Zone 4 who have been under lockdown since Saturday night. The restrictions imposed by a full lockdown are not easy to bear. These measures are creating significant hardships for the people of the Edmundston-Grand Falls region. And I would also like to say that some people are tired of COVID-19, but when we compare our situation to other places around Canada and around the world, I know that people are very tired of lockdown. But given the fact that we have very few deaths and hospitalization rates, yes, we're tired of COVID-19, but not very for the same reasons, because we are seeing results. When we follow guidance from public health and lockdown rules, we're seeing the number of cases decrease. We're seeing the number of hospitalization rates decrease. We see that the number of people affected by COVID-19 decrease.
Some of the hopeful signs we are seeing in our efforts to slow the spread of COVID-19 in New Brunswick. I also want to point out the continuing challenges that we face and how we can work together to bring the entire province back to the yellow alert level. Before we begin, I have to report that we have had another death due to COVID-19 in New Brunswick, and that this individual is a 70 to 79-year-old who was a resident at Parkland St. John's Lily Court of Tucker Hall. And this is the 14th death of a New Brunswicker since the pandemic began. And what I just said in French was that I know that people are tired. People are tired of being in lockdown in Zone 4. People are tired of being in the red phase in recovery. And many other things are tiring people out here in New Brunswick. But I have to say that our efforts have been successful up until now. And it depends what you define as success. So when you look at other provinces who are in lockdowns, other provinces who are in restricted phases of their response, they're tired of being in those phases and in those lockdowns, but they're also tired of not necessarily seeing an effect on the number of cases and the number of hospitalizations and the number of deaths. So at least here in New Brunswick, we might be tired of the efforts, but we certainly see the result of our efforts being low numbers of cases, low numbers of hospitalizations, and low numbers of deaths. But no matter how people pass away, it is always sad. So our thoughts and condolences are with the members of the families of people who have passed away from COVID-19. Another individual who tested positive for COVID-19 at Parkland St. John recently passed away as well, but this death was not being recorded as COVID-19 related. And I wish to offer my sincere condolences to the bereaved families and friends. All of New Brunswick shares in your grieving. And I just want to also comment on the fact that the decision around whether a death is considered COVID-related or not really is a team effort between the the attending physicians as well as public health. And sometimes these decisions and discussions take time. So if people are wondering why it took a little bit longer for us to declare this one COVID-related, that's why. I'd like to thank all New Brunswickers who are adhering to public health recommendations and guidance. It is making a difference. In particular, I want to express my gratitude to the residents of Zone 4, who have been under lockdown since Saturday night. And these restrictions imposed by a lockdown are not easy to bear. And these measures are creating significant hardships for the people of the Edmundston and Grand Falls region. Thank you to all who are avoiding contact with others, and to those who have sought testing when symptoms emerge. This is what's helping us get the numbers under control. These actions are helping to contain the spread of the virus. It is too soon to gauge the effect of these measures. We know that it will take time. We know that the incubation period is 2 weeks, so that is how long we know it will take to see the full effects of these actions. Si tous les citoyens de la zone 4 se limitent à leur bulle
If everyone in Zone 4 stays within their one household bubble and avoids unnecessary travel, we will have better odds for getting out of lockdown as quickly as possible. Elsewhere in the province, there are indications that we are moving in the right direction.
one household bubble and avoids unnecessary travel, we will have better odds for getting out of lockdown as quickly as possible. And elsewhere in the province, there are indications that we are moving in the right direction. And before I make any more comments about those other zones, I just want to indicate that we are breaking down the data on travel-related cases and the close contacts of those who have traveled. It is going to continue to be an issue, and that is why we have made changes to our travel restrictions. It is one thing to be dealing with outbreaks that are currently underway in the province, but it's another thing to continually have to deal with new outbreaks as a result of travel. So we really need to stay on top of all the restrictions and all of the protective measures that we can to reduce transmission of any travel-related case in the province. In Zones 2 and 3, the region centered on St. John and Fredericton, and the growth of new cases has slowed. Our contact tracing teams, my goodness, they have been working tirelessly. I have to say, I know they have been working at least 16-hour days for many, 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 many weeks. And they're really focused on trying to identify the linkages between most of the cases and the case clusters. I tell you, again, over the weekend, they worked so hard. And because of their hard work and because of your cooperation with those teams, there is now less concern for potential of community spread, because when they make those links, they can then determine that it isn't community spread. So thank you for your cooperation and all of your efforts. There have been no new outbreaks in vulnerable settings in these zones, and those affected appear to have stabilized in the recent days. Based on this, Public Health has recommended to Cabinet that Zone 2 and Zone 3 transition back to the orange alert level. This change will take effect at midnight on Tuesday. These zones will have stayed at the red alert level for a full week. This has allowed us to complete a full weekly assessment to properly gauge the impact of our measures, but be aware we will continue to monitor very closely as the incubation period is 14 days. You will recall we discussed moving the zones quickly into red to get ahead of the risk so that we could move back to orange as quickly as possible. And part of that risk was the risk of the unknown, the risk of not knowing that the links were there or not there. And not knowing if the links were there meant that there was a risk of community transmission. Because we've done this successful contact tracing, we've eliminated the worry about that risk. That doesn't mean that it can't come again. That doesn't mean that we can't have community transmission at any time, anywhere in the province. But for right now, our contact tracers have gotten ahead of these cases and made those links. I do need everybody to keep getting tested, even if they have one symptom and even if it's mild. The changes we are recommending are based on Public Health's analysis of the data and are rooted in science. We present these recommendations to Cabinet, which has the final say on these decisions. Since the pandemic began, there has been a strong collaborative relationship between Public Health and the COVID Cabinet Committee, which is unique in this country, and which has enabled us to restrain the rate of growth of the virus. And again, I just want to say how much I appreciate the opportunity to work with the COVID-19 Cabinet Committee members. It really is an honor and a privilege to be at that table and to be able to present all of our public health recommendations and evidence-based information to all the party leaders at the same time as the Cabinet. Zones 5, 6, and 7, covering northern and northeastern New Brunswick, you are doing well and we thank you. For now, these areas will remain at the orange level, though their status is under review. We remain concerned about the new variants of COVID-19 virus, which have now been confirmed in Atlantic Canada. I was on a special advisory committee call yesterday with my colleagues across the country, all the chief medical officers of health, and I can tell you that, you know, our conversations around vaccine rollout and how we are all at the same level of concern around the fact that our supply is limited across the country, and so the pace of the rollout is limited based on that. And the concern around these variants. In Ontario, it's been quite dramatic in terms of the UK variant, getting into that population, and also the African variants appearing in BC. So lots and lots of concern at this time around the variants and the impacts that it will have on our response. So while we don't have any confirmed cases of the UK or the South African variants in New Brunswick, we still need to be vigilant around the rapid spread of this new COVID-19 version of the virus. And we will be learning, just like we learned about the variants that are circulating in New Brunswick right now, not variants, sorry, the actual virus that's circulating now. You know, we've been learning for the last 10 months about this virus here in New Brunswick, but now we have to learn about these new variants, and learning takes time and it takes experience in other jurisdictions, and they will be continuing to share their experiences and their learning with us. Si la tendance actuelle se maintient,
If the current trends hold and we do not see indications of the faster moving variant in the province, we hope to recommend moving zones 5, 6, and 7 to the yellow alert level in the coming days. Zone 1 will remain at the red alert level, and Zone 4 will stay in lockdown. We need to see significant improvements in both these zones before we can consider any change in status. Today, there are 27 new confirmed cases of COVID-19 in New Brunswick. In Zone 1, which is Moncton and southeastern New Brunswick, there are 4 new cases. In Zone 2, which is St. John, Kings, and Charlotte counties, there is 1 new case. In Zone 3, which is Fredericton and the St. John River Valley, there are 3 new cases. In Zone 4, which is the Edmundston-Grand Falls region, there are 19 new cases. All of these individuals are self-isolating. The causes of these new cases remain under investigation. We know that some of them are close contacts of contacts that were already tested positive, and we know that they were already in self-isolation when there was the diagnostic, but some of them are under investigation for those 19 new cases. There are now 348 active cases in New Brunswick. 6 individuals are currently in hospital, including 3 who require intensive care.
Holds. We hope to recommend moving zones 5, 6, and 7 to a yellow alert level in the coming days. And I did mention that it would be helpful if people who have symptoms get tested, because then we feel more confident that the information that we have is reliable. And I heard somebody raise the question about rapid testing and why aren't we using rapid testing, but honestly, our targeted approach right now is around diagnostic testing, and that's the PCR-based testing. The rapid test, there is a PCR test that's a rapid test, but it's used in very specific areas, and the supply is limited, so we use it very judiciously for some pre-op testing and for some long-term care facility outbreaks to manage those at the early stages. So the other rapid tests that we do have available they're called rapid antigen screening tests. And we do have good supplies of both of them. One is the Abbott ID Now, and the other one is the PanBio. But both of those are used best in situations where people are symptomatic, And again, there are some downfalls, there are some drawbacks to using them. So we do have a plan to use them in very specific areas and for very specific reasons under specific circumstances. But it wouldn't be under the guise of mass testing of asymptomatic people at this point in time. But again, we are working with our partners with the lab and all of our public health partners in the province to continue to make sure that we have the best testing program that we can. Today, there are 27 new confirmed cases of COVID-19 in New Brunswick. And in Zone 1, which is the Moncton and southeastern New Brunswick area, there are 4 new cases. In Zone 2, which is St. John, Kings, and Charlotte counties, there is 1 new case. In Zone 3, which is Fredericton and the St. John River Valley, there are 3 new cases. In Zone 4, which is the Edmundston Grand Falls region, there are 19 new cases. All of these individuals are now self-isolating, and the causes of these new cases remain under investigation. And many of them would be close contacts of cases that were already diagnosed, in which case they were already self-isolating, but some of them are still under investigation. There are now 348 active cases in New Brunswick. 6 individuals are currently in the hospital, including 3 who require intensive care. And again, I ask that you keep every New Brunswicker whose lives have been touched by COVID-19 in your thoughts and prayers today. The resurgence of COVID-19 cases across New Brunswick over the last month has been alarming. But in most cases, there is no mystery in how it has spread. Obviously, the cases come across the border, not knowing they have COVID-19. They may or may not have symptoms. They may or may not self-isolate appropriately and safely, unbeknownst to them. And unbeknownst to them, they may asymptomatically transmit to their household members, who may asymptomatically transmit to their workplace, a school, a public area. And sometimes people do have symptoms and those people don't get tested. So we know that if somebody comes across the border and self-isolates for 14 days appropriately, then you won't have spread. But if anybody comes across the border for whatever reason and isn't self-isolating in the safest way possible, and again, some people think they are self-isolating safely, but still are at risk of transmitting. So we know that there is always going to be risk that travel-related cases are going to occur. And if people are not wearing their masks and they're not physically distancing, then there are other risks in terms of getting COVID-19. So contacts with others in workplace settings, school settings, social settings, again, without physical distancing and without wearing masks and without hand washing, et cetera, and being in close contact with people in those types of situations then increases the risk of transmission. And that's not new. That's been the case since the beginning of the pandemic. I do have some images that we're going to show. You have them on a screen?
They'll be on the screen.
Okay.
No, you just.
Oh, well, I wanted to look at them. I wanted to look at them also. I have them here. Okay, you see them on your screen, and I'm going to show the first one. Slide for Zone 1. In these images, and the reason we're doing this is because people are asking, well, every time we've done any stakeholder engagement sessions, people find the visual aspects of these quite striking. Actually, I don't have the one for Zone 1. Okay, well, I'll just have, well, I'm going to read it, yes. In these images, each case is represented by a dot, and the lines between the dots show contacts between cases, and that is the work that the contact tracers do. Shout out to the contact tracers. Many of these dots do not connect. If you see dots that aren't connected, then that illustrates that we're having issues in several communities. And again, we can see that there could be several clusters that start all at once, again, from travel, and then they spread in a community, in a region. Sometimes they spread between zones. So this image shows how the virus spread through Zone 1 in the Moncton region. And you can see that there is one very large cluster of cases that is surrounded by a series of smaller ones, which may be connected to the larger one. Again, really complex. And over the holiday period, if somebody went to a party or a gathering of some kind, then the virus got passed on that way. And then from there, it spread from a gathering to a family, to the family and friends, and then to their workplaces, and then their schools, and then into vulnerable settings. So now I'm going to show the picture for Zone 4. Alors, regardons maintenant ce qui...
Now, let's look at Zone 4, where there has been an explosion of cases in the last 2 weeks. In this area, the virus spread through a series of social gatherings into workplaces, including the Nadeau poultry plant and several long-term care homes in the area. It's obvious from this image that we don't yet know how a lot of these cases link to one another. That's one of the main reasons that Zone 4 is now in a lockdown.
Zone 2. So let's take a look at Zone 2, which is the St. John area. Here we have 2 large clusters which overlap, and there were gatherings involved, and some of the outbreak is related to the Shanix long-term care facility. And I was asked the other day about the index case and in terms of the transmission to that setting. But I don't have all the information around that. And again, we have to be very careful with our confidentiality. I mean, there's only 3 ways that it can get into a care home. It can be through staff, it can be through a visitor, it can be through a resident who leaves the facility to go on an outing and then comes back. So somehow it did get in there. And again, we have to be sensitive around those issues because obviously nobody knowingly brings COVID-19 into a vulnerable setting. Anyway, that gives us a picture of Zone 2. For Zone 3, let's look at that zone, the Fredericton area. Now, we see that there's a pattern that is repeated among all of these. You can see that it is spread in the different clusters beyond home gatherings and during the holidays, and then into workplace settings, and then families and friends of the workers in those workplace settings. So again, very complex. L'image illustre aussi comment...
There is also an illustration of how the virus spreads in workplaces. 4 cases in a workplace has grown to a cluster of 24 additional cases among the workers' families and friends.
But they have this in common. The virus will spread at every opportunity if we let it. Too many of us let our guard down over the holidays, which is why we are where we are today. But also, I think on a daily basis, every choice that we make around whether we're wearing our mask, whether we're physically distancing, whether we wash our hands, whether we leave our house when we're not feeling well, whether or not we get tested if we have symptoms or a symptom of COVID-19 affects whether or not this disease is transmitted. We can't roll back the tide of any of these cases, but we can take actions to keep the second wave from getting worse. And the most important thing we can all do right now is to monitor ourselves and our families for symptoms of COVID-19. And when those symptoms emerge, seek testing as quickly as possible. The symptomatic testing that we do is PCR-based, and the turnaround time can sometimes be slower than people would like. And I have heard complaints about people not really wanting to self-isolate during that time because it is inconvenient. But we are asking that everybody do this for the province. This is what we all need to do now and moving forward so that we can avoid seeing the variants come into our province and prevent the variants from spreading. And so we can do our vaccine rollout program so that we can protect as many New Brunswickers as possible. So yes, it's inconvenient. Yes, it's a problem, but it is necessary. And symptomatic testing is really, really much, much better than asymptomatic. The only time that asymptomatic testing is really valuable is in a targeted population where you know there's a risk. For instance, a close contact of a case who's been self-isolating, and we are doing that testing on day 10 of their self-isolation. Even if it's just one symptom, even if it seems mild or trivial, testing will help us identify how the virus is spreading, and it will enable us to get people into self-isolation and keep it from reaching everyone else. Time is of the essence, so please don't wait. Les tests de dépistage nous aideront.
Testing will help us identify how the virus is spreading and enable us to get people into self-isolation and keep it from reaching anyone else.
Testing strategy, we ramp up our testing efforts when we have to, set up additional assessment sites when required to do so, that people do not have to travel as far to seek testing. We've done this in the past in Zone 5, we're doing it in Zone 4, and with an additional assessment site in Clare. We also have added a testing site in Perth Andover in Zone 3 and a site in Sussex in Zone 2. Another site is being added in Sackville in that's Zone 2, Zone 1. Oh, it's on the border. And discussions for Lemec and Shippagan are taking place. Oh, I said Shippagan. Shediac. It says Shediac. We conduct large-scale or facility-wide rapid testing in vulnerable locations and workplace settings in concert with our prompt teams. A shout out to the prompt teams. Oh my gosh, they have been going all around this province, delivering the most effective testing and isolation for all of these long-term care facilities, adult residential facilities, nursing homes. They are working tirelessly. So great shout out for this group of people. I cannot say enough about how they're helping these vulnerable populations. Amazing. So by taking these targeted actions with your support in following public health guidance, I am confident that we can bring these outbreaks under control and get New Brunswick back on track. And I would like to clarify that tomorrow night at midnight means Tuesday into Wednesday. So demain soir à minuit, ça c'est...
So tomorrow night into midnight, that's when we will roll back to orange phase. That's for Zone 2 and Zone 3.
Shepherd.
Thank you, Dr. Russell. Merci, Dr. Russell. Not only is public health, contact tracing, and all of everyone there working diligently and hard, so is Dr. Russell, Dr. Heidi Liston, the ADM of Public Health. This has been an absolute marathon pandemic, and the amount of hours that public health employees have put in are just extensive, grueling, and certainly not the easiest thing to do. I just want to say a heartfelt thank you to all of you at Public Health, all of you in the community, extramural, running our prompt teams. You are exceptional and doing a tremendous job. Good afternoon, bonjour. Before I begin today, I want to express heartfelt condolences on behalf of all New Brunswickers to the Premier and his brother Denny and their family on the loss of their beloved mother, Bertha Higgs, at the age of 100. Losing a parent is never easy, but it is especially hard right now when we can't come together and grieve as we need to. Our thoughts and prayers are with the Higgs family today and in the days ahead as they deal with this heartbreaking loss. As well, our province has lost another person to COVID-19. This is something that never gets easier, nor should it. On behalf of all New Brunswickers, I want to express sincere condolences to this person's family and friends and all who love them. The number of active cases today, as well as the overall number of active cases, continue to be higher than we need them to be. As Dr. Russell has noted, the majority of today's cases are in Zone 1, the Moncton region, and Zone 4, the Edmundston region. This has been true of the past few days as well. In other zones, we have seen the spread of COVID-19 reduced. Because of this, we are accepting the recommendation of Public Health and are moving Zone 2, the St. John region, and Zone 3, the Fredericton region, to the orange alert level Tuesday night at midnight. The decision to make this change tomorrow night was based on a recommendation from Public Health to allow a full 7 days to pass since these zones moved into the red alert level. Zone 1, the Moncton region, will remain at the red alert level. Zone 4, the Edmundston region, will remain in lockdown. Zone 5, the Campbellton region, Zone 6, the Bathurst region, and Zone 7, the Miramichi region, We'll remain at the orange alert level for now, and we will continue to reassess the situation. We need to keep these zones in orange for now to assure the health and safety of those who live there. But if trends continue to go well in these zones, we will move all 3 to yellow once public health recommends we do so, hopefully later this week. To ensure success across the province, I encourage everyone to continue to follow the directives of public health and take the steps necessary to keep you, your loved ones, and your communities safe. Today, I am happy to share that we've now had 5 days without a confirmed positive case in any school community. Since schools reopened after the holidays, a total of 20 schools have been impacted by confirmed cases, as well as 7 early learning and child care facilities. Only 8 schools continue to be impacted, 3 of which are in Zone 4, the Edmundston region. There are no longer any positive cases affecting child care facilities. We are 5 months into the school year, and there has still been no student-to-student transmission determined in any of these cases. Our return-to-school plans have proven to be successful time and time again, but we need the continued support of New Brunswickers to keep our schools healthy and safe for the remainder of the school year. As we all know, the virus does not move on its own. If we limit our movements as much as possible, we can limit the spread of COVID-19. Some movement will always be necessary, of course, but we must continue to find ways to reduce the risk to New Brunswickers. Effective this past weekend, travel into the province was restricted further. Everyone entering our province must self-isolate for 14 days. There are exceptions for those who travel back and forth daily for work, commercial transportation operators, and those who must travel for medical care, childcare, and child custody. As well, those commuting for work or school have to do work isolation. These travelers must now submit to mandatory weekly COVID-19 testing. As Dr. Russell has said, testing access has been improved to make this easier. I understand that these measures may seem inconvenient for New Brunswickers, and I get it. We're all very tired of this virus. But know that by complying with public health directions and observing these measures, you are making a difference, and you have the power to protect lives. We have also stepped up enforcement across the province to ensure that the rules are being followed. Most of our focus is on businesses and organizations, because if they are doing the right things, then that in turn protects their staff and customers and goes a long way to protecting our community as a whole. We recognize this hasn't been easy for businesses, and I encourage businesses who are impacted by the pandemic to call the Business Navigator at 1-833-799-7966 or email nav@navnb.ca, that's NAV@navnb.ca for help. Enforcement officers have observed that the majority of business and patrons are actively cooperating with current direction. However, if there are cases of people clearly violating the emergency order, action will be taken. I'm sure many of you have heard about the actions being taken this past weekend at protests in Moncton and Quispamsis. It is important to note that the issue was not the protest. People have the right to protest, and if they are doing so lawfully, we will support their right to do so. That was the case in Woodstock this weekend, where a protest also took place. In that instance, protesters wore masks and maintained physical distancing. However, if people are not respecting the mandatory order and are putting the community at risk, I know the police will take action. We understand that people are frustrated, but putting others at risk is not acceptable. There is a light at the end of the tunnel. Vaccination clinics were held Friday and Saturday in Edmundston, Bathurst, Fredericton, and St. John to vaccinate more than 1,950 healthcare workers. That followed clinics last week where more than 1,300 people were vaccinated at 10 long-term care facilities. In total, we have administered 14,257 doses of the vaccine and have fully vaccinated 2,839 people in New Brunswick. And our work vaccinating New Brunswickers continue. Vaccination clinics are planned for 20 long-term care facilities this week, using the Moderna vaccine to provide the first dose to more than 750 people. And more than 1,600 healthcare workers are scheduled to get their second dose of the vaccine this week. This is positive news, but we still have months to go before we reach that light at the end of the tunnel. It continues to not be a matter of our ability to vaccinate, but that we do not have the vaccine in sufficient quantities yet. We all need to be patient and continue abiding by the guidance from public health, but to take the time we need to get people, we take the time we need to get people vaccinated. Acts of kindness and caring go a long way at the best of times and are even more appreciated when times are challenging like they are now. Since the pandemic began, a group of Edmundston volunteers called Les Anges Bienveillants, our caring angels, have been helping vulnerable members in their community. They have delivered groceries and kept in contact with people who are living alone. Now that the region is in a lockdown once again, they have expanded to include more acts of kindness for those in need. On top of this, they have done things such as clean snow off the cars of healthcare workers who are working the night shift at the Edmundston Regional Hospital. These are simple acts that have a huge impact on both the giver and the receiver. There have also been reports of cities outside Zone 4, the Edmundston region, taking to social media to share messages of support, reminding those in lockdown that they are not alone. The act of reaching out and making a connection, one community to another or one individual to another, will help us get through this pandemic. Yes, New Brunswickers are resilient, but this is hard. We need those reminders that we are not facing this alone. Please continue to support one another in any way you can. That is how we will come out the other side of this challenging time stronger as people and a province. Thank you. Merci.
Thank you.
Merci beaucoup, Minister Shepherd and Dr. Russell. Thank you, Minister Shepherd, Dr. Russell. We'll now proceed with questions from members of the media. Each reporter will have one question and a quick follow-up. You have the right to pose your question in the official language of your choice. Please ensure your microphones are placed on mute. Nous allons maintenant procéder aux questions des journalistes. Vous avez le droit de poser vos questions dans la langue officielle de votre choix. Chaque journaliste aura une question et un suivi. Voulez-vous assurer de désactiver le son de vos micros? Natalie Sturgeon, Telegraph Journal.
Thanks. My question is for Dr. Russell. Shanix did announce on Sunday that there were 2 deaths at Parkland St. John. I think you mentioned one of them. Why did Public Health not report these deaths on January 21st and 22nd? And what do they know about those specific deaths in relation to the COVID outbreak at Parkland St. John?
Hi, just before I answer that question, for clarity, the zones 2 and zones 3 are going back to the orange phase Tuesday at 11:59, just for clarity purposes. Alors, pour clarifier les...
To clarify, zones 2 and 3 will be rolled back to the orange phase Tuesday at 11:59 p.m. So that's tomorrow night.
Back to the Shanix cases, All I can really say is what I have already said during my remarks earlier, and that is that the decision around whether somebody's death is linked to COVID or not, or attributable to COVID or not, is based on the attending physicians as well as public health. And so when they make those decisions around the cause of death, then that is what I would report on. It is a collaborative effort. So again, the case that I reported today around the attribution to the death being to COVID-19, again, we're following our protocols and our processes around that.
Ms. Sturgeon, do you have a follow-up?
Yes. I just wanted to know, Dr. Russell, if there's any scientific data that would point to a defining difference between a patient who has COVID-19 or is tested positive and then passes away but is not a COVID-related death?
Well, again, they have protocols around defining a COVID-related death or not. There are people with obviously multiple comorbidities at the end of life. So there are multiple things that would be contributing to somebody's death. The timeline between when they tested positive and their death, were those symptoms exacerbating already underlying medical conditions that they had? I mean, there's a lot of complex discussions that have to take place. Again, it's a collaboration between the attending physicians, because there can be more than one, as well as public health.
Thank you, Ms. Sturgeon. Vicki Hogarth, CHCO TV.
Thank you, Bruce. My question is for Dr. Russell and or Minister Shepherd. Maine CDC estimates seasonal influenza rates to be down about 85% as a result of personal protective measures. Do we know if the seasonal influenza rate is down in New Brunswick this year as a result of our protective measures like social distancing and mask wearing? And have there been any positive hospitalization trends because of the precautions we've been taking?
My understanding is yes to both of those questions. Yes, our rates of transmission of flu have been down and our rates of hospitalization of flu have been down, but I will confirm that, and I can get somebody from communications to give you that data, because we actually have a weekly flu report that has that in our document. So it could actually be on the website right now. So you actually have access to that. It reports on flu, and it also reports on influenza. It reports on influenza number of cases, number of hospitalizations and deaths. It also includes influenza-like symptoms as well, and illnesses.
Ms. Hogarth, do you have a follow-up?
Dr. Russell, Canada is sending on average about 5% of its positive COVID-19 cases to the National Laboratory to test for the UK strain. Why not send all positive cases, especially in New Brunswick where we don't have as many as other provinces?
Well, we have a lab group that works on all of these issues around what goes to NML and what doesn't. And again, that's in collaboration with public health. So these teams meet weekly, sometimes more than once a week, to discuss all of these issues and the technical components around that. So I am comfortable with the testing, the samples that are sent right now, and I'm comfortable with their ability to determine if something needs to change in that area.
Thank you. Jacques Poitras, CBC.
Hello. For Dr. Russell or Minister Shepherd, where do things stand with any changes, adjustments to vaccine rollout given the reduced Pfizer numbers? I see that today Ontario, for example, says they're going to delay some shots for healthcare workers to favor long-term care residents. Are you making any decisions like that here?
For us, the vaccinations are affecting healthcare workers because we are using the Moderna vaccine in our long-term care facilities, and so those vaccine rollouts will continue as planned. So right now, we will be utilizing vaccine as we receive them. We are dependent on the federal government for those shipments, and it will not be affecting long-term care at this time because of the fact that we are using Moderna.
Mr. Poitras, do you have a follow-up?
I guess I was using that as an example. Are you planning any changes to your planned rollout to account for the lower levels of Pfizer vaccine coming in February?
Well, we can't issue vaccines if we don't have the vaccine to release. So absolutely, we are making those changes. We have been assured that the shipments will be will be ramped up in March, and so that we should be able to meet our planned vaccination rollout for Q1 in the month of March. That has yet to be seen. We can only hope that that is what will happen, and we will certainly ramp up our vaccinations in the month of March to try to fulfill the plan that we have, because our goal is to get to September and be where we want to be. So these kind of adjustments have to be made. We have to work with them, and we will continue to do so. So I expect March is going to be very busy.
Thank you, Mr. Poitras. Laura Lyle, CTV.
Thank you, Bruce. This question would be for Dr. Russell. With the situation what is the situation in the Moncton region currently, and why is that zone not moving in the same direction as St. John and Fredericton?
So in terms of what is happening in Zone 2 and Zone 3, again, we were seeing that all the cases that we were worried about not being linked were able to be linked. So the contact tracers, again, they worked really, really hard over the weekend to make those linkages. And I think in Moncton, we're just still continuing to see workplace transmission. So we're going to be keeping an eye on that as we move forward. But again, I know they're working very, very hard as well. And again, we'll continue to monitor that situation.
Ms. Lyle, do you have a follow-up?
I do. As far as I understand it, the residents of Parkland St. John have all received their first vaccination dose, with the exception of Lily Court and Portland Court. Families inside of Portland Court especially want to see their family members vaccinated. Now that the number of active cases is down to, I believe, 5, is that something that's going to be happening?
So there is a clinic that is being planned shortly.
Thank you, Ms. Lyle. Harry Forstall, CBC.
Thank you. This first question to Minister Shepherd. Can you please explain how people will be alerted that they're going to be vaccinated, and how those who are without a family doctor, who lack a New Brunswick health number, or who are still registered with another province's healthcare system, how they will be contacted and told about their vaccinations?
So as I explained before, many individuals will actually be alerted by Medicare, and so that's going to take care of one group that you've asked about, and so they're going to be coming in a we will be targeting those. Right now they're 85 years of age and older, and once we've gone through this first quarter, then of course those numbers will come down to 80 and 75 and 70, and Medicare will take care of identifying those who we already know. As for individuals who may be awaiting, I'm thinking you might, Harry, be referring to citizenship or permanent status in the province. As we also provide them with medical services, I'm sure that we have a way to identify them. Going to have to confirm that with you to be absolutely assured of that. But as I've been working through the department and being briefed at different times, we certainly are in touch with most of them, and especially through our associations who support them, and we will ensure that no one is left behind.
Just to clarify, it also affects people moving from other provinces who may be Canadian citizens from the get-go, right?
Right. So we're going to have to confirm, one, that they're not vaccinated in another province, and I know that there is a transition time. I'm going to expect that these individuals are most likely mobile, and that they would be going through the process. So by the time we get to September, we should be able to come through and identify all those who have not received their vaccinations yet, and anyone can certainly contact the Department of Health or Public Health to ask that question on behalf of any of their family members.
Mr. Forstall, do you have a quick follow-up?
Yes, I do, Bruce. This is for Dr. Russell. Is Public Health looking at or dealing with the phenomenon of so-called long-haul COVID? In other words, those patients who have been diagnosed and treated for COVID-19, but who days, weeks, or months after still have the effects of COVID-19.
I'm going to step in on Dr. Russell for this one. So I had mentioned in previous briefings that we do actually have a group, and I thought it originated in St. John, but it's actually Moncton City Hospital, I believe, who are following COVID patients who have become COVID infected, and then following them to see what those long-term effects are. And I would be very happy to get you the researcher on that, and you could follow up with them to see where they're at with it.
Brad Perry, CHSJ.
Hi there. Thank you, Bruce. This question is for Dr. Russell. I wanted to go back to the two recent deaths at Parkland St. John. You did mention one of them is not considered a COVID-related death. Back in December, Public Health had introduced an update to the dashboard to add a non-COVID-related death category after a resident there who tested positive died but not of COVID. It looks like as of right now, it doesn't appear this most recent case is being included as part of that category. Can you maybe explain why that is?
Well, I can certainly bring that back to our team. But as of right now, again, the protocols around our reporting are based on that assessment between public health and the attending physicians, and our dashboard will be updated accordingly. But that's, again, we're following the protocols that we have in place right now.
Mr. Perry, do you have a follow-up?
I do. Thank you, Bruce. This is also for Dr. Russell. I just wanted to clarify, you mentioned there were two resident deaths at Parkland St. John last week, one Thursday and one Friday. Can you confirm which of the two deaths were COVID-related and which of the two were not COVID-related?
Well, I think that would be breaching confidentiality of the families of the residents involved, and I wouldn't want to be releasing any personal information.
Thank you, Mr. Perry. Marie Sutherland, CBC.
Hi, my question's for Dr. Russell or Minister Shepherd. Last week, the Department of Health confirmed delivery of almost 200,000 or something like that rapid tests to New Brunswick. And Dr. Russell, you were sort of suggesting these are of limited use, but what is the plan for their use? That's a lot of tests, and I know airports, for example, keep stressing that these are crucial. So what is the plan for their use?
So I'm going to walk you through the test types again to talk about what they're used for and what they're designed for. So the test at the George Dumont, the PCR test, that's the gold standard. It does take a little bit longer, but is the most reliable for symptomatic and asymptomatic testing. We do have one that's also PCR based that's called Gene Expert. It's able to be used for quicker turnaround time, but the problem with that one is that we just have very, very few very limited supplies of that across the country. So every province has to use that very, very, very judiciously. So we do it for some pre-ops, we do it for some long-term care facility outbreaks early on, and again, it can be used for symptomatic or asymptomatic people. So the other two that are considered rapid antigen tests, yes, we have them in large numbers, but they are limited to be used for people who are symptomatic, number one. Number two, the Abbott ID rapid test has to be used by about day 7 of somebody being symptomatic. Both of them have problems with reliability in terms of specificity and sensitivity. In particular, the PanBio has more limitations around false negatives and false positives. So both of them, the Abbott ID Now and the PanBio, both have to have confirmatory tests with the PCR. So you're going to be double testing the ones that are positive. And if you have negative tests, you're not completely confident that they actually are negative, so you could be missing some. So there are some very limited ways that we do plan to use both of them. I did have a list last Thursday and Friday. I don't know if I have all of the lists of how we're going to use it, but I do have that list, and I can make that available to you because we do have it. Let me just, actually, I know I have it, sorry. do have it. There we go. Okay, I know I have the list for the Abbott ID now. I don't know if I have everything for PanBio. So again, the Abbott ID now is a point-of-care test. It is a rapid test, but it's an antigen test. It's not a PCR test, and it's a screening test, not a diagnostic test. And we do have several Abbott ID now point-of-care testing products in the regional health authorities. Again, it's a screening test. It's only really valuable for symptomatic patients, and again, has to be confirmed with the George Dumont PCR test. There are 41 of these instruments around in the regional health authorities, and they have 22,632 tests to be able to do those tests. And again, I know I have a longer list of what the PanBio will be used for as well. We're going to have to get that to you, but I do have the total list of what both of those are going to be used for. Well, actually, all four, actually. Okie dokie. Thanks.
Are we good, Ms. Sutherland?
Yep, thank you. I do have a follow-up question.
Quick one.
Dr. Russell, have you been dealing with people who are refusing to get tested, specifically Netto plant workers, and is getting tested actually voluntary in a case such as Netto?
Well, we can't force anybody to get tested. That would really not be something that public health would be able to do. However, if somebody doesn't choose to get tested, then they probably would be asked to self-isolate for 14 days, is my assumption. That's usually how they would approach that.
Thank you. Jean-Philippe Hugues, Radio-Canada.
Oui, bonjour.
Yes, so I would like to hear what you said in French. Can you explain why you decided to wait for Zone 2 and 3 to be rolled back to the orange phase? So the answer that I gave in English, it was about the type of transmission that we see in Zone 1. Most of the transmission is occurring at workplaces. Mr. Hugues, do you have a follow-up question? Yes, I would like to receive an update on nursing homes in Zone 4 where there are outbreaks. For example, the Bellevue Villa des Jardins nursing homes. How many cases in those nursing homes? So in Zone 4, there's Villa des Jardins. There's one staff that was tested positive. We started screening tests on January 24th. And it's 81 residents and 22 staff members. And we're waiting for the results at this point. And the next time that we will do the screening test will be on January 27th for Bellevue Nursing Home. We saw that someone tested positive. There were 2 screening test days with positive cases every time. And in total, 21 residents and 12 staff members tested positive. And the next time we will conduct screening tests will be on January 26th. And also in Zone 4, there's Pavillon Royer. Someone tested positive there. So they conducted screening tests on January 21st. Results were all negative that day. And the next screening test was January 25th, so that's today, and we're going to receive results, I hope, tomorrow. Is that okay? Mr. Hugues? In those 3 nursing homes, which ones already received Moderna doses and which one had not started vaccination? So you would like to know which one of those nursing homes already received the vaccine? I will come back with that information later. Simon Delattre, Acadie Nouvelle. Yes, question for Dr. Russell. Louder. So residents in Leslie-Gauche will need to undergo a screening test to go across the border. What will be the benefit of this test? Because they will not be tested on the same day as when they cross the border. Cross the border to come into New Brunswick, you mean? Yes, exactly. Outside of the country or from other places within Canada to come into New Brunswick. So you're asking if we are conducting screening tests or? Because when those people are crossing the border, it's not done on the same day as screening tests. So you're talking about essential workers? Is that what you mean? Everyone who wants to cross the border for essential reasons. So they need to conduct screening tests. I think that decision was made last week.
So I apologize, I must answer in English. So at Pointe de la Croix, residents are able to come over once a week for necessities. They may come over for work. They may come over for medical appointments and any other essential travel such as childcare, custody. And these regular travelers are subjected to a COVID test weekly. And so it wouldn't be on any specific day, but I would assume weekly appointments would be made for them to enable their traveling.
Thank you, Minister.
Do you have a follow-up question? Yes. So it's a question about a study that was conducted in Montreal. And it's a drug that can be used to treat COVID-19. Did you analyze this study in New Brunswick, and could we administer this drug to New Brunswick patients? Yesterday, I discussed this issue with my colleagues everywhere in the country. That research was published, but more discussion is needed to validate that research. We still don't have clear direction on this research at this point. Thank you.
Hi there. I have some questions about a job posting for two of the province's regional medical officers of health. Without getting into personal details, I wonder if either of you can tell me how long these positions have been vacant and how exactly the work of the public health department has been affected by turnover in these leadership positions, during, perhaps the most difficult period this province has seen, in contending with the global pandemic. Thanks.
So it's my understanding that job postings went up mid-December. The vacancies have only happened, I believe, this week. And so we are working together with our other medical officers of health to cover off areas, and with Dr. Russell, Dr. Muick, who works with her, in continuing the support to the areas that are necessary. And of course, the processes will go through in having those positions replaced.
And I would just like to add that while Dr. Paquette and Dr. Lamptey were working in public health for the entire time that I've been in public health, it is a loss that we will definitely feel. They were excellent medical officers. As acquaintances, as friends, as colleagues, very much valued their expertise throughout the time that I've been in public health. So yeah, we've been looking at different ways of filling the gaps. Recruiting obviously is not easy in the best of times, but certainly during a pandemic we'll have some challenges. But we're working very diligently with HR and myself and Dr. Muick, the deputy chief. When I was first hired as deputy chief back in 2014, my job was actually to cover the regional medical officers of health when they were on leave. I think I covered mat leave for Dr. Lamptey. I covered sick leave for other positions. So I'm very familiar with the work that they do. I think we're all stretched right now, but I know that Dr. Barker has been covering the Fredericton's region and the St. John region. She's been doing an excellent job. Dr. Legere covers the Moncton region. So yeah, we'll have to combine all of our efforts to cover the north, and hopefully the positions will be filled sooner rather than later, and we'll have a full complement of medical officers.
Mr. Bateman, do you have a quick follow?
Yeah, that's great. Thank you. I just want to shift gears and go back to those graphics that you presented earlier, Dr. Russell. Can we have some more information about what exactly those are portraying? Perhaps you can tell us, whether the different shading or size of the dots represent something. Maybe there's some of those dots have 2 lines between them instead of 1, or maybe what time frame is being represented in the images. Can we just have a bit more on that? Thanks.
So we have presented these slides many times, myself and Dr. Liston, to COVID cabinet. We've presented them to leaders in different zones. They're a tool to help us help others understand what we know, because we're working behind the scenes, so we have all the intel. But it's hard to really break that down into digestible bites for people and without giving away too much with respect to confidentiality. So there are way more details that accompany these slides in terms of who, where, what, and how. But for the representation purposes of showing how complex the connections are, how connected we all are in the province, that's really the point of this, is that the asymptomatic transmission that happens through events, workplace settings, school, the symptomatic transmission that happens when people do not get tested and go to any of these places, it really provides a snapshot of what it is that we want people to understand so that they can then change their behaviors to address the risks that we're identifying here. So the risks we're identifying are, 1, if you're self-isolating as a result of travel, please do it properly. Number 2, knowing that it can happen that you're not doing it properly for whatever reason, your household members are at risk. They are at risk of transmitting asymptomatically. And certainly anybody with symptoms who goes to different functions, workplaces, et cetera, is at risk of transmitting. So that is why we want everybody who has even mild symptoms to get tested.
Thank you, Mr. Bateman. Savannah, Telegraph Journal.
Hi, this could probably go to the minister or Dr. Russell. I'm wondering if you can update us on how many health workers and long-term care workers in Zone 4 are isolating, and if there's any concern at this point around hospital or ICU capacity as a result of this.
So Savannah, I do have that information with me. I'm sorry I can't do it off the top of my head. I have to look at cheat notes. So a total of 84 healthcare employees are off work due to COVID-19 related reasons, 50 in Horizon, 25 in Vitalité, and 11 extramural ambulance New Brunswick. 4 surgeries were canceled in Horizon Health on Friday. And that can sometimes be because of medical staff, but it can also be that individuals who are booked for surgery couldn't get their test results done in time or back before their surgery date.
Ms. do you have a follow-up?
I do, thank you, Bruce. This one's for Dr. Russell. You mentioned you're concerned, of course, about the variant, and you said zones 5, 6, and 7 might move to yellow in a few days if we continue to see no evidence of the variant here, if I heard you correctly on that. So have we seen trends, I guess, in the test results or in our communities that suggest that the variant is unlikely to be here yet? Could you maybe just tell me about that?
Well, we do have criteria around which samples we send to NML for analysis and genetic sequencing to see if the variants are here in the province. So all the tests that we've sent so far came back negative for the variants. I'm not sure if we have any outstanding right now, but certainly our conversations, again, my conversations with my colleagues yesterday with the chief medical officers of health from across the country were quite concerning in terms of what they're seeing in their provinces, such as Ontario and British Columbia, around the variants and what risks they're now faced with because of that. So, our goal would be to go to yellow in terms of having those areas that don't have cases and we're not at risk the way the other zones are at the moment. But with the introduction of that variant, the spread can be so quick. We're just really evaluating what those elevated risks mean. So we've sent 19 samples already for the genetic sequencing. 14 came back negative, and we've got 5 that are pending.
Thank you, Doctor. Thank you, Ms. Odd. Gilles Duval, TVA.
Oui, bonjour.
Bonjour.
Yes, hello. Is it possible to describe the situation in terms of the Nadeau poultry plant? And there were also potential cases at the Domaine des Bâtisseurs. So I'm just wondering what is the state of the situation for Domaine des Bâtisseurs and the Nadeau poultry plant in Zone 4. Thank you. So for Nadeau, screening test will be done for all staff today and tomorrow. And your next question was regarding Domaine des Bâtisseurs and Résidence Jodin. There was a potential case there, but there was no follow-up on that later. I believe that the outbreak at Jodin was declared over because there were no other positive results. So for the Nadeau poultry plant, there were no new cases over the past few days. Well, the screening test will be done today and tomorrow. So for an additional question, there seems to be a confusion in the Haute-Madawaska region. We're asking ourselves, when a person has tested positive, can the spouse of that household leave the house and go into the community? Public health makes that call, and nurses who deal with contact tracing. So if it's a close contact, they will need to self-isolate. But that's a conversation to be had between contact tracing team and that individual.
Yes. So, Dr. Russell, the non-COVID related deaths you discussed today isn't reflected on the dashboard, yet the total number of deaths recovered and active cases add up. And there's still one death announced by Shanix on January 12th, not reflected on the dashboard at all as COVID related or non-COVID related. So why is that?
I will have to get back to you on that.
Next question.
Okay, Dr. Russell and Minister Shepherd, please. Families of Shanix residents who tested positive for COVID and died are suggesting public health is misrepresenting their deaths as being non-COVID related. How do you respond to that?
It's a really difficult time for families, and I appreciate that. But there's absolutely no reason for public health to not be upfront as much as possible and have been with this. So there's absolutely no cover-up, no skewing of data. This is a clinical decision, and we leave that up to the clinicians to give it to us.
Thank you. Mia Urquhart, CBC.
Thanks, Bruce. My question is for Minister Shepherd. The province's licensed practical nurses have asked government for a meeting to discuss a number of their concerns, including wages, responsibilities, and job classification. This morning, their union said the province is on the verge of a recruitment and retention crisis. CUPE has also raised a number of issues. How concerned are you about losing LPNs over these issues, and do you plan to meet with them to discuss their concerns?
First, I want to say that every single province in this country is under a recruitment and retention crisis. It is, it's no secret that in the healthcare sector, we have a shortage of healthcare professionals in almost every single category. Secondly, I understand the LPN situation and their angst at wanting to meet. I certainly don't have any objection to meeting with them, but I certainly would like to ensure that we have all the information that I need before that kind of a meeting takes place, and I'm sure that that won't be in the too far future.
Ms. Urquhart, do you have a follow?
I do. This one is for Dr. Russell. Are there any plans to tighten self-isolation rules to require that if someone in a household has traveled outside the province, every member of that household must isolate for 14 days, as is done in Nova Scotia? And if not, why not?
My understanding that in the mandatory order, it specifies that if you cannot isolate safely away from your family members in the same location, then you should go to a different location. That's my understanding of how it reads in the mandatory order. And my understanding is that Department of Public Safety, either on their written, computerized registration forms or verbally will ask people about their self-isolation plan. So obviously, proper self-isolation for a full 14 days by yourself in a location away from others is the safest way to prevent the transmission of COVID-19. We saw that this past summer with all of our temporary foreign workers and our international students who all self-isolated by themselves for the full 14 days. And of all of the 1,000 people who did that, I think we had a handful of positive cases because they all got tested on day 10 of their self-isolation, but not one of those cases transmitted to another person because there was no ability for that to happen. So moving forward, the strictest self-isolation that can happen should be happening. Again, if you can't self-isolate safely away from household members, then you really should self-isolate in a different location.
Thank you, Ms. Urquhart. Sarah Plowman, CTV.
Hi, we're hearing concerns across the country about vaccines, about Pfizer not having any vaccines coming to Canada this week, and you talked about it earlier, but can you share with us just how concerned is New Brunswick with the lack of supply coming into the country right now, and how is that hindering your progress? You said that you'd reach, Q1 targets. But I don't know. Are you able? Is it? If you could explain how this is helping or hurting you guys right now.
I think it's creating an angst in the public. Certainly, no doubt. And our whole goal is to ensure that we have, our Q1 people, which would be healthcare professionals. It would be long-term care residents, and so we want to ensure that we get them vaccinated as soon as possible. We know that we could vaccinate up to 4,500 people a day if we had the vaccine. We know we're not going to get that much. So we are asking everyone to be patient, to work with us as we move forward. We have created priority groups because of the fact that we know we don't have enough vaccinations to give on a daily basis. We have to some extent, rely on our federal government to get us the supplies we needed and we need. So they work with Pfizer on a daily basis. Pfizer has maintained that our supplies will be ramped up in the month of March, giving us that supply that we had planned for in January, February, March, so that we can be on target at the end of March. And we are going to hold fast to that. That's our plan. And we will give vaccines out as quickly as we get them.
And are you in a position,
Sarah.
or have you,
Sarah.
Ottawa?
Sarah, just let the doctor answer first. Sorry.
Sorry.
Yeah, so we're all in the same boat across the country. So each and every jurisdiction has the same issues around the per capita allocation of the procurement of all of the doses of vaccines that are purchased at the federal level. So every province is in the same boat. Nobody is able to vaccinate as quickly as they would like. So that's across the board in Canada. And certainly, if we're all trying to get to the finish line of herd immunity by, September-ish 2021, that's many months from now. And whether it's the 2 mRNA vaccines that allows us to do that, or the ones that are hopefully going to be approved by Health Canada, over the coming months, and however that's going to happen, then obviously we'll be glad to get to that point. There are barriers and obstacles along the way that we all as a country have to deal with, including New Brunswick. So the barriers that we have right now, again, is that per capita allocation is not going to change. The rate of the delivery of the doses is not going to change. If we could accelerate it, we would, absolutely, and there are some unknowns around that. So yes, we know that Pfizer is guaranteed that they're going to give us enough doses in the month of March to be able to meet our targets by the end of March for long-term care facility residents and healthcare workers. So it's just taking a longer amount of time. Now, what happens after Q1 and in terms of the doses that we're going to be getting after that, again, up in the air, but again, if everything goes well, if everything goes exactly how we would hope, then we'll have another priority group vaccinated between April and June, and then the rest of the population will be vaccinated between June and September. But again, that's if everything goes well, and I know many, many things are going to change between now and then, including what the risks are across the country in terms of the variants affecting us, the continuation of travel-related cases carrying those variants coming internationally and domestically. And so that's why the bottom line, regardless of how the vaccine rollout goes based on those limitations, we all have to do our part right now to protect the healthcare system and the healthcare workers so that when we do want to give those vaccines that we have enough healthcare workers to do that and they're not busy taking care of COVID patients and that everybody's here to receive the vaccine. So we don't want anybody left behind.
You have a quick follow, Ms. Plowman?
Yeah, given the information you know now, which of course might change, but given what you know now, what is your strategy then to be able to reach your target by Q1? You mentioned some healthcare workers won't get vaccinated. About how many won't get vaccinated, and what else will you have to do to be able to quickly, vaccinate more people if the doses come later?
So the clinics to administer the first dose of the Pfizer vaccine are not planned for this week, but our work is continuing for vaccinating New Brunswickers. And the vaccination clinics are planned for 20 long-term care facilities starting today using the Moderna vaccine. And so we'll be providing the first dose to more than 750 people, and that's going to be held in Zone 1, 3, 5, 6, and 7. More than 1,600 healthcare workers are scheduled to get their second dose of the vaccine this week. There are no first dose clinics planned for the Pfizer vaccine. Knowing that these interruptions can happen, we took that account with respect to second doses, and they are going to be administered within 28 days. And while the clinics to administer a first dose of Pfizer are, sorry, I said that already. So if there are any additional unplanned events that occur that would not allow us to maintain our 28-day interval, we have reserved a 14-day window within which we can readjust our vaccine allocation to ensure second doses are provided within the national recommended time frame of 42 days. And we continue to use that same plan, that same approach moving forward. I do want to commend the immunization task force on their work that has contributed to all of this. The planning is extensive. The collaboration with other groups within public health and within the regional health authorities has been outstanding. This is a very complex time with respect to the nature of some of the unknowns that they're working with. So they did try to build in some of those unknown factors into their planning with contingency plans and what have you. So we're working on the technical side and the operational side very well together at this moment in time. Again, around what happens if there are these delays and what are the time frames that we have to work with and what are the changes that we can make within those time frames.
Thank you, Ms. Plowman. Patrick Giguère, CHAU-TVA.
Yes, hello. My question is for Dr. Russell. So just to be sure, New Brunswick workers go to Quebec to work day and night. So do they need to self-isolate when they come back home? Do they need to go through a screening test? Could you please repeat your question? Yes, I'm wondering whether New Brunswick workers who need to work in Quebec day and night, do they need to go through a COVID-19 screening test, and do they need to self-isolate when they come back home? So According to the information I received regarding essential workers who need to come back and forth every day, I believe they need to be tested at least once a week. That's the information that I received, but if there are any more details on this, I can give them to you. So this applies to Quebec workers and New Brunswick workers who need to cross the borders day and night to go to work. For New Brunswickers. For New Brunswickers, yes. Okay, because some companies in Gaspésie fear that with these new measures, their staff member who live in Campbellton and who need to go to Pointe-à-la-Croix, well, for certain employees, it will be more difficult to go through a COVID-19 screening test. So employers are afraid of losing employees who will not want to go through this screening test. So what can you tell them to reassure them?
Apologies, I have to answer you in English. So employees from Quebec who work consistently in New Brunswick would be subjected, and I'm assuming the employer has gone through the proper protocol to make proper arrangements, they would most likely be tested weekly. They would be expected to work isolate, meaning that they only go to work and they go home. They do not be about in their communities. A New Brunswick employee who has to travel into Quebec for work must again be tested weekly in order to continue that. It is inconvenient. This is a difficult and inconvenient time. And lots of New Brunswickers don't even have the benefit of going to work. So this is a way that we can protect our people. And those who are coming to New Brunswick to do a job and are only coming here on a one-time deal will have to self-isolate for 14 days. This, again, is for the protection of our communities in both provinces.
Do you have a follow-up question? Yes, so for Avignon, we have no active cases. So those screening measures, I'm wondering, how long will they last? How many weeks? How many days?
We are constantly. I would expect that these measures will last. Really, I believe these are new measures brought forward to Cabinet by the recommendation of COVID Cabinet Committee. And I believe they will be in place for the foreseeable future until we get through our vaccination process, until we have mass vaccinations out there in our communities, till we understand the variants that are now we are at risk of being exposed to. I believe that this procedure and these restrictions will be in place for the foreseeable future.
Yes, it's really to manage the risk and the number of cases that we see increasing throughout the world and the effect of the UK variant. It's already in 30 countries, and in Ontario, we have the South Africa variant in British Columbia. Our risk is increasing. We need to manage the risk. And the only way we can go about this is by introducing those changes. And when the risks are reduced, and when there is mass vaccination in New Brunswick, as the Minister Shepherd stated, it's really important to manage the risk until our risk decrease.
Merci beaucoup tout le monde. Voilà la fin de notre mise à jour. That concludes today's update. Thank you.